I'm Dr. Matt Rasmussen with Periodontics and Implant Dentistry of Tallahassee. More and more patients are asking about dental implants and have been specifically asking about a particular type of procedure commonly known as an all-on-X type of procedure or all-on-4 type of procedure. We're going to spend some time today going over the specifics of that type of dental implant process and what's involved kind of start to finish. There's a common type of procedure known as an all-on-4 dental implant type of prosthesis. It's a coined term basically meaning that if we're going to remove all the natural teeth, we're going to have a new set of teeth that are permanent in the sense that they are fixed in the mouth and that are placed on top of 4 dental implants. Therefore, all the teeth are placed on 4 or all on 4. An all-on-4 procedure is different than traditional dental implants in the sense of how many dental implants are being used to replace the remaining natural teeth and how much additional grafting procedures are needed. Grafting is where additional bone is added to particular locations in the mouth. So the all-on-4 type of procedure can sometimes offer a lower cost than traditional dental implants as there's slightly less work involved for the right candidate for that type of procedure. An all-on-4 type of procedure involves removing the remaining natural teeth, smoothing down the bone to make available room, and then placing 4 dental implants as anchors for a set of natural teeth. For a patient to be a good candidate for an all-on-4 dental implant type of prosthesis, enough bone needs to be available in the locations to place 4 strong dental implants to be available to hold on to all the natural teeth that go on top. A common question we get is what are good options for seniors regarding dental implants? All-on-4 dental implants are popular because they give a fixed solution, meaning they're going to replace all the natural teeth and you can bite and chew with confidence, with relatively less invasive procedures. For this reason, many senior patients prefer this type of procedure because less surgery is involved and less recovery time is involved to still get them the results that they need. However, for senior citizens, we need to make sure that there is adequate bone and their medical history is sufficient so they can proceed with all-on-4 type of dental implants. The all-on-4 dental implant process involves a series of steps that go relatively quickly. Typically, all the teeth on the upper, the bottom, or possibly both jaws are removed, the bone is smoothed down, and then 4 dental implants are placed. If the implants go in with adequate torque, meaning that the implants are ready to accept the teeth that are going on top, which many times is the case, then teeth will be put in place that same day. It is a temporary that's going to be used during the healing phase, and then the finals are made once everything is complete. But again, many times for the all-on-4 dental procedure, the day that the patient leaves the office for the initial surgery, they will leave with teeth that are fixed in their mouth. An all-on-4 dental solution is meant to be a permanent device. Now, of course, like with anything else, there is maintenance involved and there are complications that can arise. But when an all-on-4 dental prosthesis is delivered to the patient, it is not something that is meant to be only a temporary solution. It is meant to be a long-term solution for the patient. A very common question we get in the office is, how does an all-on-4 dental implant procedure differ from other types of tooth replacement options? The all-on-4 dental procedure has a couple of specific advantages. First, there's less grafting or additional procedures that are involved, so less pain and less cost by comparison to certain other options for dental procedures. The other thing is that it's one of the ways that we can get what we call a fixed option in the mouth, meaning the teeth do not come in and out. Many of the other options like traditional dentures or overdentures or other types of dentures involve a denture that comes in and out even with the assistance of implants. With an all-on-4 dental type of procedure, the teeth stay fixed in the mouth. A common question we get is what do patients look like before and after an all-on-4 dental type of prosthesis or dental implants? Feel free to look at our website as you can see many examples of what people look like before and after a strong smile makeover. Many times patients that come into the office feel very self-conscious about their teeth before an all-on-4 type of dental prosthesis. They don't smile because they don't like the appearance of their teeth or they feel uncomfortable. Afterwards, because we have the option to make a full set of teeth, oftentimes for both the upper and the lower, patients are very happy as they have a new smile and they can smile with confidence. All-on-4 dental implants are a game changer in the sense that they can improve the quality of life. Many patients who come to us for this type of procedure report they have not been able to eat certain types of food, they've not been able to have social interactions, and their overall happiness has decreased over the years because they are self-conscious about their smile or they have pain in their mouth. After an all-on-4 type of dental prosthesis is placed and completed, the patient can eat, chew, talk, and smile with confidence. They regain their natural youthfulness in life, and many times patients report they look 10 years younger or more because of the new smile that they have. All-on-4 dental implants are a wonderful tooth replacement solution. However, like any other dental procedure that can be performed, there are potential complications that can arise. It's important to talk with your doctor about these complications before the time of the surgery, and it's critically important to make sure that we maintain the dental implants afterwards. The most common complications that can arise will either relate to the denture itself. Remember, the dental implants on an all-on-4 procedure still are connected to a fixed type of denture. So a tooth can chip just like any other tooth can chip. And then also, there are potential biological complications with the dental implants themselves, meaning we're depending on the patient's body to hold the implants in place. If there's bone that's lost around those implants or the body rejects an implant, those can be complications that would need to be addressed. The recovery process after an all-on-4 dental implant type of prosthesis is one that's very similar to most common surgeries. Typically, patients will be sore for 2 to 3 days after the procedure, where they get to their most swollen point, and then 2 to 3 days on the way back down. Typically, within a week, most patients report they do not have pain or swelling after an all-on-4 procedure. A common question that comes up in the office is, what type of maintenance or aftercare is involved with all-on-4 implants? I'm going to break this up into 2 specific phases. The first phase relates to the actual teeth that are involved in the all-on-4 process. Like anything else that has consistent contact, think of tires on a car or something else like that, there is wear that's going to occur over time. So it is common at some point, usually somewhere between 5 and 10 years after an all-on-4 procedure, where the teeth may need to be retreaded or a new set of teeth added to the existing denture. And that's okay, that's expected with the process. The other part of the maintenance phase involves the actual implants themselves. Remember, there's a biological process happening between the dental implant that's anchored to the bone and the bone itself. We need to make sure that those implants stay healthy long term. So there are cleanings involved in other aftercare instructions that we'll go over with you at the time of the procedure that are still needed to make sure those implants stay healthy long term. I hope we've been able to answer some of the most common questions regarding all-on-4 types of dental implants. Certainly, many patients will have more specific questions to their individual circumstances. Give us a call at area code 850-692-9200. We look forward to talking with you about the all-on-4 dental type of prosthesis and how we can help you with your oral health.